Hi, today we'd like to talk about another rare type of disorder that affects women, which is vaginal atresia. So this condition is a congenital abnormality in the female reproductive tract. So specifically, there's a partial or complete absence of parts of the vagina and the vaginal opening. So sometimes there is no vaginal opening, or the vaginal opening is far too small and it's covered in fibrous tissue. So this is a congenital malformation of the vaginal canal, and usually it develops during embryogenesis. So you are actually born with it. So the cause is because during embryogenesis, during early pregnancy, when the embryo is still developing, there is a defect in the fusion of certain ducts. So leading to this congenital defect. So diagnosis is immediately done when the baby is born, and we can immediately diagnose that, oh, there's a presence of vaginal atresia when we do an examination of the baby. So most people are diagnosed the moment that they are born. However, some are not diagnosed during when they are born. So they go on to their adult lives, especially during adolescence when they experience menstruation. They don't experience menstruation, but they do still experience periodic abdominal pains because they still can menstruate. However, the menses blood is unable to exit, so it causes accumulation inside the cavity, inside the pelvic cavity, inside the uterine cavity. And this can cause some very painful menses. So that's why the abdominal pain is happening, the lower back pain, and it's happening periodically. So this is also a primary amenorrhea, and then pelvic pains caused by this vaginal atresia. So although commonly it is a congenital condition, rarely it can be an acquired condition as well. So you acquire this after being born, somehow during certain accidents, certain trauma, or some prolonged untreated inflammations of the vagina can lead to vaginal atresia. So symptoms, as I mentioned before, firstly is that you go through your adolescence life, your adult life without any menstruation, but you experience periodic abdominal pains and crampings. Secondly is that you have difficulty in sexual intercourse, or you are unable to engage in sexual intercourse at all. Thirdly is you physically feel that the vaginal opening is far too small or far too not present as well. This is also possible. If it's undetected or undiagnosed by any doctor, you can feel it for yourself and then bring yourself to a doctor, and we can do a full gynecological examination. So because we cannot enter through the vaginal canal to examine, so we will need to enter to the anal rectum using laparoscopic skills as well to diagnose this vaginal atresia. For vaginal atresia, only the lower segments of the vaginal canal is affected, and also the vaginal opening. These are the ones that are either partially absent or completely absent. However, these patients have normal uterus, normal cervix, normal fallopian tubes, and normal ovaries. All of these are functioning and present. Only the lower segment of the vaginal canal and the opening is affected. So upon diagnosis, we will quickly need you to go for treatment, because these patients usually they have a lot of psychological issues because they are unable to have a good quality of life, plus peer pressure because they are unable to menstruate, unable to engage in sexual intercourse. There's psychological pressure on them. So to alleviate this, we do need to go into surgical management. So we will do a vaginal reconstructive surgery, a metroplasty. So use surgical techniques to actually reconstruct the vaginal canal and then also restore the vaginal opening. So these women can actually, after surgery, they can actually engage in normal sexual intercourse. They can also orgasm normally, and then they can also menstruate regularly. They can go on to have children and start their own family. All of these will be alleviated once you have properly diagnosed, properly treated. Antai Hospital offers this treatment for women who are experiencing these rare abnormality of the reproductive canal. We offer you a full contractual treatment because this condition, although it's rare, it's completely treatable, and you can have your children, you can have a normal, good quality of life. Now get in touch with us to find out more information about this vaginal atresia. share this video, and also get in touch with us via the website. Set up an online consultation today.